my dear Cambrians. How are you all? So, today is Friday. After few days, we will meet in school. And I hope my all students are physically fit, mentally fit, and psychologically prepared, physiologically prepared for attend the classes in school campus. Because according to the government guidelines, maximum schools will be reopened under government guidelines. School has made every arrangement regarding same. I hope you all will join the school from very first of October. Students, we are interacting with each other. I mean, our communication, students and teachers, only online basis since 5 months. Sorry, light has go on. Be waiting for your presence in school premises. My topic is sports injuries and classification. Students, in daily life we are getting so many injuries in our life while working, while playing, even in daily routine work. We are having so many injuries in our life. So we will discuss today regarding some injuries like soft tissue injuries, abrasion, contusions, laceration, incision, along with sprain and strain. Then we will discuss about bone and joint injuries like dislocation, fracture, like stress, compound fracture, communicated fracture, as well as green stick injury, then impact fracture. And what are the causes of these injuries? How we can prevent from these various injuries from our life, and what kind of treatment we will give for our patient, or I would say those who are having such kind of injuries. You see every day so many peoples of all over the world, I mean of every age in the world, participating in game and sports activities. Even they are doing physical workout. Participation in sports and games improves physical fitness. You know, in the field of sports, there are hardly any player of the world who has not been hurt physically as well as mentally. When the players play, they are likely to be hurt. Injuries which are suffered by sportsmen during their training or participation in game and sports, known as sports injuries. These injuries are usually found over skin, muscles, and bones in sports activities. I'm sitting near street and vegetable owner is calling. But don't worry, it's a part of life also. So today we will discuss about classification of sports injuries. We are having two types of injuries: external injuries as well as internal injuries. External injuries, we are having soft tissue injury, we are having skin injuries. In skin injuries, we are having abrasion, contusions, laceration, and incision. We are having soft tissue injuries, sprain and strain. And hard tissue injuries, we are having hard mean, just like we are having bones, we are having joints, they are related to hard tissue injuries. Bone injury, fracture, so many types are there: green stick fracture, communicated fracture, then impact fracture, transverse fracture, then oblique fracture, then stress fracture. So these are the types of fracture in the bone injuries. Now we are having joint injury. In joint injury, shoulder joints, hip joint, wrist joint, lower jaw dislocation, even so many other joints also, ankle joint we can say, wrist joint we can say. It's a dislocation of these joints. So I would say these are called joints injuries, and joints related to directly to form of shoulder bones, so elbow bones, wrist bones, as I told you. Even hip joints can also be hurt if you are getting so many injuries. So, today I would like to discuss regarding external injuries. In this injury, we are having today we will discuss about soft tissue injuries. I mean, abrasion. Abrasion is a, we can say, part of skin lost. You know, is an injury to the surface of skin. I can say abrasion is an injury of skin. It exposes the blood vessels and the superficial layer of skin is scraped off. You know, this type of injury may not be serious, what can be serious. We cannot say this is not serious injury. We can take every injury be seriously. I mean, initial stage it may not harmful, but afterward it can harmful for our life. So we should not, I mean to say, we should not ignore such kind of injuries from our life. You see, this type of injuries I told you may not be serious, but can be serious if some material like small stones or sticks struck in it. Either we can say any kind of uh, types of mirrors, parts of mirror in that. So we can say we should take it seriously. If we are having such kind of injuries, we should take care properly for rehabilitation and all. So next one is, this injury is commonly caused by sliding or friction. Is our palm, we can say our elbow also, because while diving in tennis, but abrasion is common in all games. Uh, because knees are in various physical activities, kho in game of playing kabaddi and all, when we are diving, even when we are jumping, we are using these all body parts. Game and task, we have to take care. I mean, we should not avoid if we are having such kind of injuries, and we should take proper, we can cover up the situation better. This is very very essential for everyone. Then what are the causes of these injuries? Main cause of abrasion is due to sliding or friction. uh, uh, Friction is there, even you know while diving in kabaddi, of knees are always used in that, while diving in the volleyball, even sometime while diving in tennis also. So I would say we can use the knees most probably in every game, even in sprint races also, sometime whenever we are getting start and all, and the knees will come first. So we should take care about that, and these are the causes, for the purpose of prevention every injury, bone injury, either skin injury, either sprain, either strain. So before running, we should do better. This is necessary condition. I would say whenever their muscles are not allowing, so they should have. What is the treatment for soft tissue? Clean and clean the area whenever you are having any kind of injuries. So clean the area of abrasion lotion. It's like Dettol we can use. We can use so many creams. We should, are you are having such kind of injury in your school? bringing you to MI room. We are having nurses in our school, so they are doing bandage for you. They are, anti tetanus injection should be taken whenever you are having such kind of injuries. If there is severe pain, then some painkiller may be given. The medicine only on recommendation of the doctor only, because if we are getting so many medicines without recommendation of qualified doctor, diseases for our bones, for our skin, I mean for every injuries. So it's most important to take proper precaution. I would say we should take proper qualified medical staff for that. Then brushes. Second is brushes. It is superficial injury, a direct hit or blow uh, anywhere on the body, causing bleeding from reputed small capillaries below the skin without any breaking of skin is called contusions. Contusions. In such cases, upper skin remain unaffected part. Contusion mostly occur with hitting the hard wall. If directly the ball hits skin, the injury spots appear to the blue. Color of skin will be blue. Causes it occur. It occurs because of direct blow against skin or direct hit of any sports equipment. Just like in cricket, sometime a batsman hit the ball hit to immediately any fielder, or ball hit to bowler even, then he or maybe hit very badly, then afterward will be blue. So these are, we can I mean confusion brushes. So what kind of treatment we should give for them, and what kind of prevention we can important. You see, in this we should take proper without this we cannot go ahead. Precaution mean proper warming up should be there. Players should a good anticipation. Anticipation mean agility. When ball is coming, he should alert. He should be very active and careful during the practice and competition. As I told you, it happen anytime, anywhere. Even while practicing also, while playing also, while competition also, even without playing also, may happen. But we should from our side only. This is only prevention. He should use proper protective equipments if required. Equipments required, just like in cricket, equipments required for only a wicket keeper and batsman. Other cannot wear gloves. Other fielders, so they have to take care actively, proactively. Then treatment of first aid of this. What treatment we should give? Immediately apply a cold compression, or we can say ice therapy to him, or 10 to 20 minutes. Even we are also suggesting of our players, whenever they are having such kind of injuries, do ice therapy, ice massage we can say. So immediately they can stop the blood flow, as well as so this is a treatment of this. And continues ice massage 3 or 4 in a day. Then we can say after 3 days apply heat instead of eye massage, and massage gently to reduce swelling. And massage will reduce the swelling of the player. So students, we discuss about two injuries, as well as their meaning of that injuries, how these kind of injuries maybe happen. If we are having such kind of injuries, what we should take to avoid such kind of injuries, and what kind of treatment, or we can say such kind of players suffered from these injuries. So I hope, because as I told you so many times, even we are a common person. Beta, injury maybe happen anytime, anywhere without any intimation. Even while climbing the bus, while running, simple running, while jogging also. If we peoples are doing any kind of physical activities, we can get injuries. So matter is how we can prevent from injuries. So we should proactive for that. We should have take proper knowledge regarding same. If we are having proper knowledge regarding first aid, regarding these injuries, what happened to me, because every time doctors will not in front of you, medical staffs will not in front of you, because everybody they cannot take care of. Then you have to take proper knowledge regarding sprain, regarding strain and all. If you knows about these all the things, then you can take first aid by your own. So this is a very good, alarming situation for everyone, because injury may be traveling. So many good like band-aids, just like Dettol, you have to take with you. No one knows whenever you are traveling Hoshiarpur to Delhi. No. So such kind of you. So these are the prevention also for common man. Was most probably whenever we are playing in a good team, then medical staff is also available. But whenever we are care about that, so please keep in mind whenever you are playing, you should keep this first aid little bit box with you always. So I would say you followed my point, what I am talking about, beyond the syllabus, because injury may be happen anywhere, anytime. Injury will not intimidate you. Keep in mind, only precaution in your hand, your alertness, your activeness, as well as I would say your knowledge regarding these sprain, strain and all. So I hope you understood this. This is a medical esteem, biological esteem. These all injuries may, as I told you, maybe have time anywhere in the life. We cannot stop them. What we can overcome them. We can sustain to your gratitude regarding your health. So thank you very much for patience listening to. I will start 2 or 3 more injuries, and I hope you enjoyed this, because the light has gone. I am sitting on stairs outside my house. Inconvenience is this. Well, now light is not there in my house. Still, I am present in front. So thank you very much for patience listening. Hope you enjoyed this. Thank you. We'll meet you campus in 1st of October. Then online again tomorrow. I'll meet you. So thank you very much. God bless you all.